order. We have a rules. We're going to move, and we're going to move fast. So, to my committee members, be succinct with your questions. And probably we will not hear testimony unless from people in the audience, other than maybe I'll say everybody in favor stand up, and unless somebody's opposed to it, so that we can get out here, because several of us have rules over on the Senate side that we need to go see. Is Senator Unterman here yet? No. Okay, that's all right. We'll move with let's call Representative. Let's go Representative Bodie. And this is HR 446. Okay, and we will be working off LC 401525S. LC 401525S. I know that after the committee's discussion the other day that the representative has worked very hard on this with several people that have helped him on this to make it more encompassing and a more comprehensive measure. So you've got the stand.
Thank you so much, Madam Chair. And you're exactly correct. We made this House resolution to encompass not only heat-related injuries, but also cardiac arrest, and also other injuries that could be spinal injuries. Actually, in my research, and I appreciate Kathleen helping me out with this as well, we actually found out that it is more cardiac arrest related injuries across the country in youth sports, even more so than heat-related injuries. So thank you so much to the committee for spawning my interest in going to look even further. So what my bill is, what my resolution also does is we actually decrease the number of committee members from 7 to 5 to make it more economical. And we also added in there numbers from the CDC. We have stats such as 1,442,533 injuries occur in high school athletics, including football, wrestling, soccer, basketball, girls basketball, men's basketball, volleyball, baseball, and women's softball. So this resolution is going to cover just more than football. So it will cover track, it will cover volleyball, it will cover basketball. So being that the CDC states that 2.6 million children from the ages of 0 to 19 are treated in the emergency department every year for sports and recreational related injuries, I just think this is a good resolution. We get a study committee together and see how we can make Georgia a leader across the United States on this issue. So I'll just ask for a pass to vote on this, Madam Chair.
Okay. Representative Newton, you're the expert being an emergency room physician, but the tie-in also, I mean, if you're having a heat stroke, wouldn't it probably lead to cardiac complications, which, or could lead to them also, which might hasten death?
It is hard to tell initially. A lot of times when there is a sudden death of a middle school or high school athlete, whether it's in a school setting or not, I think this covers the grounds very well for the challenges that we have, and really being able to make a difference about things we can propose, whether it's different screening that we do in advance, different questions about family history, a lot of things I think this study committee can look at for ways to minimize these tragic deaths. And I think, and I really appreciate the author making these adjustments and inclusions to encompass much more than just the heat and football, but so many sports. I think that this is an excellent, I think, improvement in the bill and the ability to make a difference for Georgia athletes and their families.
Thank you so much, Representative Newton.
Okay. Representative Broadway.
Thank you, Madam Chair. Representative Bodie, in your study committee, you're looking, I guess, at basically high school athletes, but could you also incorporate the Georgia Parks and Recreation departments to have some guidelines for volunteer coaches as far as?
Yes, sir.
I think that'd be very important too, because you probably got more athletes in those programs across the state than you do even in the high school sports.
And Representative, I truly appreciate that question. I apologize. I actually mentioned that at the last hearing. This resolution is also going to cover youth sports as well. At least with high school sports, we do have the Georgia High School Sports Association, but however, we do not have anything that's uniform for youth sports. I gave the example in Gwinnett County, in their Parks and Recreation, they have 16 different youth sports leagues that's operating in Gwinnett County. So we definitely need something uniform across the state of Georgia.
Okay.
Certainly. Thank you.
Representative Reiners.
Thank you, Madam Chair, and at the conclusion of my remarks, I'd like to make a motion to pass if appropriate. All I ask is to be cautious on the youth volunteers. I don't want a teen mom in a dugout to think that she's got to be a medical expert. We ran across that with Billy Mitchell's bill a couple of years ago, and
Yes,
also
sir.
hope that you look for some inclusion from the Health and Human Services Committee, since we could very well get the legislation. And with that, Madam Chair, I move to pass.
Well, so do we.
Thank you so much. I would definitely do that, Chairman.
Okay, I have a proposal. I have a second. Okay, we've got a second. Any other discussion on the bill? Okay, if not, everyone in favor of the substitute, make sure I've got the right one. The substitute to House Resolution 446, that's LC 401525S, say aye. Anyone opposed? No? Okay, the ayes have it.
Thank you so much, Madam. Thank you, committee
Okay,
members.
is Senator Unterman here yet? No. Okay, I'm gonna do it. Okay, which bill is that? Which one's hers? It's a need to get out of here. All right, let's call Senate 193. I carried this bill last year. Okay, and what this is that the department, as they tried to implement this, could not, and you can tell her as you text her, it's because of us being short on time and trying to get this out. My committee members want to get to Senate rules, so I need to move. Okay, so it's a cleanup. Apparently they ran into some glitches and it's a technical cleanup of that bill that passed out for the Positive Alternative to Pregnancy and Parenting Grant Program. And as so often at this time, we've incorporated a writer. One of the problems that we are having, we have the bill that didn't move out of our committee. Ah, there you are. We're moving fast. You're on. I had the honor of carrying this bill last year. I'm going to carry it on the floor, so I was moving. Okay, you're on, Senator, if you need time to catch your breath. Okay. She's here if she wants to do whatever.
Okay, which bill are we gonna do?
I was doing Senate Bill 193.
That's the Pregnancy Resource Center.
You got it.
Great. The Pregnancy Resource Center bill is a cleanup bill from last year. As you recall, we created a partnership with the Pregnancy Resource Centers across the state of Georgia, and I believe there's over 70 of them. And during the interim of last year and this year, I've been working with them. We had appropriated $2 million to disperse to them, and working with the Department of Public Health. I'm not sure if they're here, but working with them, we found some problems within trying to contract and vendor this money out. So this is the cleanup language that is going to allow us to be able to do that. Within the state budget, we have reappropriated that money that will give the ability to be able to do that.
Do you want me to do the addition to it?
Yes, I do.
Thank you very
Thank
much,
you.
and I appreciate the senator. We have a bill that passed out of this committee and out of the Senate. It was the expedited partner bill. And, you know, as it does, a lot of things don't get out. So if you'll remember that bill, it's where a doctor can write a prescription. If somebody comes in with symptoms and they find that they have gonorrhea or chlamydia, the doctor can write a prescription without seeing the partner. And the reason that this is so important that we would connect it, and it's connected to this bill because the Positive Alternatives to Pregnancy and Parenting programs are trying to get healthy babies to our state. And the CDC and the Public Health Department are also trying to get healthy babies here. An untreated chlamydia infection has been linked to the following problems during pregnancy: preterm labor, premature rupture of the membranes, and low birth weight. The newborn may also be infected during delivery as the baby passes through the birth canal, and exposed newborns can develop eye and lung infections. This is a real problem, but it is a treatable problem with just like in some cases, one dose of a medicine it can do. Untreated gonorrhea infections in pregnancy have been linked to miscarriages, premature births, and low birth weights, premature rupture of the membranes, and a word I can't pronounce. Gonorrhea can also infect infants during delivery as the infant passes through the birth canal, and it can lead to severe eye infection and blindness even if it goes untreated. You know, we want healthy babies. We are on the bottom of almost the nation, and what we do and our successful rates with pregnancy and babies, and the state pays a huge cost for many of these if they get here with problems. So that is why the bill has been incorporated into this. Do we have any questions for the senator or for me? And that bill did pass out of this committee, passed out of the House. It passed out last year by Representative Jaspers. And last year it came out of this committee and passed out. So, any questions? Jaspers?
Ma'am, I just want to just thank you for including Section 3.2 on line 130 in this bill, and I think they go well together and they make a great impact on the citizens of Georgia.
Thank you. And I'm looking forward to the first part of the bill really working in both of them to see what these centers can do in helping us get healthy babies. Representative Newton.
Thank you, Madam Chair. I also want to thank you for this. This is a practice that so many physicians had done because it was the right thing, but they had been practicing without the protections that this bill brings. I mean, physicians, nurse practitioners, midwives, and other people have been trying to treat the partners. I think this is an excellent addition to a great opportunity, and at the appropriate time, I'd like to make a motion to pass.
Okay, and thank you, Representative Newton, but I'll tell you, making it more legal for y'all was not my objective. My objective is to improve our maternal child health rates and get healthy babies here without problems. So, but that I'm also glad that it does the other, and thank you for bringing that up. Anybody else? Okay. Is there anybody against the bill that wanted to testify? I know there's lots of people. Do you want to stand up that you're for it, or just we know you're there? And
I think
you're
we'll
for it?
wave off. We would just like to see
Okay.
the bill moved.
Representative Newton, I'm ready for a motion.
I move do pass.
Okay.
LC 337073S.
Okay, I have got a do pass. Do I have any further discussion from the committee? Okay, hearing none. Everybody in favor of the passage of the substitute to Senate Bill 193, say aye. Aye. Anyone opposed? No. The ayes have it. Thank you, Senator, for bringing the bill, clearing that up. And this was the Pregnancy Resource Centers, I know, are a special project for you, like many others. I mean, we're making great strides with our street kids that are being sexually abused.
Yes,
and
ma'am, and I would
exploited.
like to let the House Health Committee know that we did put money in the budget for maternal mortality. And it's the first time ever that we have we're the lowest state in the nation for maternal mortality, and we actually put a line item into the budget this year for a coordinator to start public health deciphering why that is and creating statistics to improve our outcomes.
Thank you very much for that. It works well when the two health committees work together, the only ones headed by nurses in the country. So
That's right.
By that. Okay. Did we vote on that one yet? Okay, everybody in the favor of the passage? No, we did that one. Okay, we're through. Sorry. Trying to move fast to get my members over to Senate rules. Senate Bill 41, Senator Unterman.
Okay, we're working to a substitute on Senate Bill 41, LC 337065S. And I was given this substitute this morning, and I agree with this substitute. This bill enables the durable medical equipment, which I had originally a lot of people ask me, what is that? And unfortunately, if you've ever taken care of an invalid in your home and you try to keep a person in their home, you know that you have to call up someone to get a hospital bed, to get oxygen, to get a porta potty, to get a walker, to get a wheelchair. That's exactly what these people do, is supply these types of equipment. And unfortunately, after taking care of my in-laws that are both sick with Alzheimer's and dementia, I found out that yes, this industry does need to be regulated because there are some unscrupulous characters. And with the emerging baby boomers, where we're going to see an uptick in this demand for services in the next few years and the next 10 years, I think it's imperative that we join other states that are also regulating durable medical equipment. During the Senate process, we had several exclusions. We wanted to make sure that we matched the Medicare definition. We also wanted to make sure that we basically didn't outlaw the Walmarts and the CVS's of the world, that you would still be able to go there and buy a cane or buy bandages or whatever you need to take care of a loved one. This is home products that are delivered to a home, so it's a little bit different. But we included that exceptional language. We also had a group of biomedical companies that wanted an inclusion of products that they sell almost like pacemakers, insulin pumps, those types of things, and they are also excluded in this bill. So we are basically down to those beds and porta potties that I was talking about, and making sure that the market stays the same with the Medicare reimbursement rates, and I think we've perfected a good bill. I'll be glad to answer any questions.
Okay, and we've got them, and remember, still committee members that came in late, we are moving rapidly because we have members that want to go to Senate rules. Okay, Representative Henson.
Thank you very much. Does this pertain only to Medicaid?
No.
Okay, currently with insurance and with what they consider durable medical supplies, you're not allowed, or insurance will not reimburse you, or at least State Health of Georgia, if it's a durable medical supply and you buy it from a CVS or Walmart. Because
This
they
doesn't
don't,
change the market, no.
well, but you're just saying the canes and bandages and such.
No, I was joking. I was using an example.
Okay, but there are things that you could buy at CVS.
Oh, yeah,
or
you
at
still,
Walmart.
the market, you want to go to CVS, you want to buy all that stuff, you can still do it.
But if it's considered durable medical supplies,
This
insurance will
does
not
not
reimburse.
force you to have to go to one of those companies. No, you can still go to the Walmarts of the world.
I think let me explain
Okay.
the point I'm trying to make. The point I'm trying to make is insurance will not reimburse you if you go to a pharmacy instead of some place that sells durable medical supplies because they don't, quote unquote, have the correct licensing. So if I go to a CVS, or a Tuxedo Pharmacy, which I did
John will bring you
to get compression hose, state benefit plan throws it out because it was not bought from a durable medical supply facility.
I don't think that's true.
It is true. I'm going through it right now.
All this bill does is regulate the industry that is already providing it. It is not changing the payer or the payee mix.
But what I'm trying to say is, in addition to this, possibly we should allow someone to be able
Oh.
to buy it from a pharmacy.
I think you
not
could
to
write a
have it
bill
thrown
next
out.
year for that.
Okay, but I just wanted to clarify.
Yeah. Yeah, I understand what you're saying. I'm sorry I interrupted you.
Representative Petrie.
Yes, ma'am. Thank you, Senator. Isn't it true that this bill deals with an industry that is overwhelmingly paid for by government?
Yes,
And the truth of the matter is that right now we have no way of tracking those providers.
That's exactly
In fact,
right.
we don't know how many providers there are in the
that's
state.
why I brought up the baby boomers. That's exactly right.
Absolutely. And so this is an attempt to deal with fraud in a big way. And this bill does not impact in any way private sales, as I
That's
understand.
exactly right. It's protecting consumers.
Thank you, Senator.
Okay, Representative Pizzo.
Thank you. Senator, I'm concerned with if you want to shine shoes in this state, you have to get a license.
Right. If you get your hair cut, you have to get a license.
Also absurd. Is there any limit on what we should require licenses to do business in this state, in your opinion?
Well, I think that's a different question than the bill. I've been here a long time. I've done a lot of licensing.
Thank you.
Representative Broderick.
Thank you, Madam Chair. Senator, the purpose of the bill is only to create a licensing board, and there's nothing in the bill that would require credentialing of those providers.
That's right.
Thank you.
Okay. Representative Reinders.
Thank you, Madam Chair, and thank you, Senator, for bringing this bill. Is it not true that you have some providers, when you talk about unscrupulous, that may be billing the government for one
Yep,
chair and then billing
Yep.
for the same chair, the same person?
yep, and that's why.
And that's why we're trying to do this.
Yep.
So good
That's-
conservative government
Right,
would be not to let somebody bill somebody twice or three times
right.
for the same chair.
Right, and there's accountability and transparency, and you're exactly right, and that's why I brought up my in-laws, because when you're taking care of someone that's 80 and 90 years old, fraud is very, very easy.
Is it not true, if I may continue, that you've got some people that need something for a time being, then they sell it, pawn it, whatever the case may be. When they go through an illness again, then they come back and ask the second time for it, and therefore are getting two pieces of equipment when they should have had just the one, and the government's
All
paying
you
for
gotta
it
do
twice.
is go to Goodwill and look at them for sale.
Absolutely. Thank you so much for this, and at the appropriate time, Madam Chair, I move do pass.
Thank
Okay,
you.
I've got another question, Representative Barr. And hopefully, this will be the last question, unless somebody has a burning desire. Oh, sorry, Representative Price.
I was just going to say, primarily to respond to Representative Pizzo's concern about the licensing. The business or the world, the DME world actually is behind this to keep them competitive with our neighboring states.
That's exactly right. Thank you. I appreciate you bringing it up.
Okay.
This bill's actually been around for 3 years now.
Well, and I think we served on a
Panel?
to panel when we went to Bork.
Exactly.
And got to face that, which
Yeah, we're real
reminds me.
proud of this, and I especially want to say thank you for the industry for promoting it and protecting consumers.
And did Bork ever make any of those changes to put in a health component? Remember, they said they were not equipped to handle health requests to license.
Yeah, I've heard about the hearing aids.
Maybe we should work on that next year.
Yeah, we
send it
should.
together to make it an addition to the
I'd love
Bork
to do that.
Commission. Okay, I'll put it on my list to talk to you about first this session. Okay. Okay, we're at the time, Reinders.
Thank you, Madam Chairwoman, and thank you, Madam Chairwoman. I move do pass.
Okay, I've got a do pass in a second. Is there any discussion from committee members? None. Do I have anybody that's against it in the audience? Okay, seeing nobody that's against it. Everyone in favor of the passage of the substitute to 41? Senate Bill 41, it's LC 3370665S. Say aye. Aye. Anyone opposed, no? And Senator, I would take it, I'm gonna carry the first bill, Petrie thing,
That's
are you
great.
carrying the second one?
That's
I'll
great.
turn in the thing and I will put in a request for.
Do you know if it'll be eligible today?
I don't know, but,
You want me to take it over there for you?
no, I'll do it. And I will ask, if we can't get, we do probably more than you do of adding things on. So I will ask for that. Thank you very much. Okay, and we'll see you in Senate Rules. Oh, an hour later, it's at 3? Okay. House Resolution 431. Okay, well, you snooze, you lose sometimes around here. Okay, what bill have we got? Which was the next one? Senate Resolution, okay. Okay, House Resolution 627, it's not on your agenda. It was added. We're ready for you, Representative. Sorry, Sharper. You snooze, you lose. You lost your seat. Oh, we're good. But we'll let you vote.
Thank
I'm
you,
just
Madam Chair.
teasing you.
So what I have here is a study committee for mental health and addiction, and what I want to do is study the issue because it is such a big issue that affects so many people in Georgia. Most people have a loved one, a child, a parent, a spouse, an aunt, an uncle, a friend, someone they know that's affected by mental health and addiction, and it's impacting so many areas of our state. And so this study committee, there's a lot of new paradigms in addiction treatment, and I want to look at those new treatments. I want to look at what's working. A lot of effective programs are coming out of the nonprofit world, and most people can't afford treatment. And so I think the statistic I read is 11% of the U.S. population actually gets treated for mental health and addiction, and some of those aren't necessarily effective. It may be a revolving door of, you know, they go into the hospital for 28 days and then they stick them back into their environments and they relapse, and it becomes a revolving door. So what I want to do is look at what's working in the nonprofit world where they have long-term programs and marrying it with traditional counseling resources and some alternative modalities that have been shown to be effective, and start looking at that and what's working so that we can do better and look at ways to fund mental health and addiction, because even if it's with a nonprofit, it still costs money to go to these programs. And if we had a way to fund people being able to go to these programs and get the long-term treatment they need, we could stop the revolving door. But this is impacting our homelessness rates. I mean, people that go untreated, they either end up in jails, they end up homeless, they end up, some of them are suicidal. You know, we've got just astronomical numbers of grandparents trying to raise grandkids because they've got children that are addicted. We've got lots of kids in our foster system because of it. We've got lots of people in our jails, and I want to look at what we can do to prevent this epidemic. So I'm asking that y'all pass this and we can devote the resources necessary to effectively study this issue and look at better ways to go about doing this in our state.
Thank you, Representative. We've got several questions. Representative Hatchett.
Thank you, Madam Chair. Hey, Paulette. We have another bill that's out there right now. I don't know if you're aware of it. It's Senate Bill 4 that deals with everything you've mentioned pretty much and maybe a little more. And I mean, I think your resolution is great and it's definitely needed. And I kind of believe that hopefully Senate Bill will be coming out in the next 2 days, and maybe if it doesn't, this will be ready to go. But I mean, I'm thinking that Senate Bill 4 will address most everything you have. It's going to have 9 members on the task force and then 21 defined members from different communities, including law enforcement, psychiatric, hospitals, everything. So hopefully you can, if that goes through, you can help with that too. So.
Yeah, I'd love to help with that. And I think that's kind of taking a different look at the whole issue, and I just want, you know, this to be a different way to approach looking at it. And because it is such a big chronic problem, and it's, you know, resulting in a lot of broken families, it becomes more chronic. The more generations we go through where you've got broken families, you've got more opportunities for abuse, as families tear apart, for, you know, sexual abuse, mental abuse, emotional abuse, abandonment issues, and those are a lot of the new paradigms and the drivers of addiction. And if you can get to the root of healing those things, then you can start putting families back together. So thank you. But I would love to be a part of that study.
Okay, Representative Petrie.
Yes, thank you, Representative. I had not seen this resolution prior to this moment, but I did want to mention something. You know, we don't know what's coming down from the feds, but I will tell you this: having served many waivered programs through Medicaid over the years that deal with developmentally disabled and people who are aging, we've never had anything like that with mental health. And there's a lot of conversation about if things change and the feds start giving Georgia more influence over doing things its own way, that we could create waivered programs to do things in our own unique way in Georgia to serve people with mental health. And so I think I would say this, and I heard Representative Hatchett mention some other things that are happening on the Senate side. It is very timely, I would say, that we begin to think about the most efficient and the most effective ways of serving people with mental illness. It is the greatest failure in this state in terms of a population that we serve and in most states. And I do think it's very timely because we're going to be dealing with a new way likely of funding programs to make sure they're efficient and effective. And so I do think the timeliness is very good.
Thank you.
Representative Pizzo.
Thank you, Madam Chair. I'm not opposed to the study committee, but I do have a question, maybe for the committee, but lines 12 and 13 talk about the absence of an adequate number of such treatments and programs. Isn't it true that last week we passed Senate Bill 88, which limits the number of treatment facilities?
That's just for opioid addiction.
Okay, but this is for addiction treatment
And I
as
believe,
well, right?
this is for looking at the addict and not just the method that they've
Okay.
chosen to check out and numb their pain. And that bill, the opioid addiction, I think that was about methadone clinics and limiting the number of methadone clinics. And if you've ever talked to anyone that's been a heroin addict, it's really sad because they're like, you know, it takes 2 or 3 days to kick heroin, but when you're on methadone, it takes you about 2 months, and it's really hard to get off of. So I think that's a good thing we did to limit, you know, I think we might need less of that, but if we can get to the root drivers of the addiction and look at ways to really heal those root drivers and heal the addict, then you don't have to chase opioid, meth, whatever the drug of the season is, and take a siloed approach to doing that.
Thank you. Representative Henson.
Thank you. As we move forward with these study committees, I hope one of the things that and they come forth with recommendations, one of the things that I certainly hope that we're willing to do is to put the adequate amount of money into the budget for the nonprofits that will be coming to us in order to treat these folks. Because at times they are woefully underfunded.
They are. And they're relying on private donations and then families that have the
But
money to go with
we, as a
it.
state, I think, if we're going to be doing this, studying this, I think we have an obligation to put the money in to help these nonprofits. Thank you.
Thank you.
Bill.
The last of the questions from the committee. Representative Reinders.
Thank you, and thank you to the author for, we talked about this on the floor, and you made some change in this, and to my friend Representative Henson's concern, is it not true that this originally had funding in the name to talk about that particular issue?
Yes, it did.
And it is also not true that you agreed that that was a little about putting the the horse before the cart, because we actually didn't know how much that would cost us, and we didn't want to mandate without knowing what the cost is?
Right.
And I thank you for your spirit of cooperation on that, but that is something that we treat with a great deal of sincerity, as it should be. Now, I'm going to address the proverbial elephant in the room, if you will. You'd come to this committee before with something that several members of the committee, I might even speculate the majority, had some concerns, as we didn't want to run afoul with a federal definition or federal law as it deals with things like pornography. Additionally, there's some questions out there about gambling. When you say addiction treatment, and you mentioned earlier the sexual abuse, which is obviously a serious problem, I'm going to ask you, as a friend, is this your intent to be able to engage the resolution that wasn't successful before? In other words, will you assure us that this isn't the purpose, a different way calling it addiction, instead of looking at what you were previously doing?
No, this is to study addictions as a whole, whether it's gambling, whether it's pornography,
So you
whether
could
it's
include
drugs,
it.
whether it's alcohol. It's to study
Sharper.
addictions and the person
your seat, the
and
lady.
what's driving the addictions, not, and how we can
But
treat
you understand,
the
if this
holistic
committee
person.
didn't want to take it up, and this is what they perceive to be a backdoor way of you doing that, by changing the wording from pornography or gambling to addiction, then it can give the false pretense that it's not really just about addictions, it's really about your first agenda that came before this committee.
Now, actually, that agenda, this was the whole driver, because when I saw that act, I saw, okay, this is a way we could actually fund this issue. So this was the issue from the beginning, and I saw that as a funding source, but I really would like to look at all funding sources and what we can do to bring effective funding and effective treatments to the individuals that are suffering from addictions.
Madam Chair, if I may continue, I'm trying to find out where your heart is. You came to this committee with another resolution that was not taken up. You agree?
Yes.
I don't want this to be the backdoor way of you doing the same thing for your first agenda. Is
No,
it?
that's not my first agenda.
Okay.
This was my first agenda.
All right, I just
So-
want to make the committee aware of that. Thank
Yes.
you, Madam Chair.
Well, I think, let's just be very honest. Should this get out of the Rules Committee, Representative, and you turn it into something that it is not supposed to be, and you have said it won't be, you will have one heck of a time of ever getting anything else out of this committee, because what we have down here is our word.
Right.
And, you know, we move forward in trust, but I believe in trust and verify, and if that trust is violated, then I think it'll be very difficult to, and we have a very big committee and long memories. So, Representative Newton.
Thank you, Madam Chair. I was just looking real quickly at a bill we recently addressed, which is Senate Bill 4, that established a Georgia Mental Health Treatment Task Force. What would be the significant differences between that fairly large committee that was a task force, but it also had an advisory committee? What are the differences in this one that other entity couldn't take care of?
Well, I think the other entity was focused on some other areas of treatment, looking at the hospitals, looking at, I don't know that they were looking for, you know, how can we effectively fund this? How can we look at what the nonprofits are doing and how effective those are? I don't remember everything that was in it, but, you know, this is just taking a different look at, you know, let's look at the drivers of addiction and healing the addict from the inside out versus, you know, putting them in the revolving door of treatment, and let's look at what's effective. I mean, I'd like to measure, you know, what kind of success rates are we getting from, you know, these type of treatment programs that are long-term in nature. So it's just taking a different look at it and looking at ways to fund this without, you know, doing tax increases. So things like, I mean, we have a gambling bill. That's a good way to look at funding it, and looking at what else we have on the table that would be a possible way to fund it. That's what that Human Trafficking Prevention Act came out of, because there was a funding mechanism there. And so just studying those things as a whole, and not just, you know, the hospital stuff and what we're doing currently.
Thank you. Just if I may follow up, I guess that bill did discuss substance abuse and dependence. It talked about the need to study effectiveness of services and healthcare programs currently available for those with or at risk for serious mental illness, which I think addiction with negative consequences would fall in that. It does look like there'll be some overlap.
There probably will be. So I would like to be involved with that committee as well, because it's something very near and dear to my heart, is looking at, you know, fixing the problems driving addiction, and, you know, not doing the things that aren't working, but doing more of what does work, and having more adequate resources throughout the state for that. In the county I live in, we had a juvenile drug court, and they shut it down. And, you know, and it took me years to get an adult drug court in the county, like 13 years. But they shut it down, and I asked them why, and they said because they didn't have anywhere to send these people to treat them. And so that's gotten better with the CBDs, but those are still short-term treatments. And if you've ever dealt with people with addiction, you know, sometimes you have to get them away from their phones, their cars, their computers, and every access point to drugs, because if they can, you know, find a way to get to the drugs, they will. And that's just the first step in treating them is.
We are now 20 minutes till 2.
Okay.
And I have one more person to go.
Okay. So.
All right. Representative.
Yeah, I'm going back to my previous concern, I'm gonna ask for a spirit of cooperation from the author to try to help move it forward. And with the help of legislative counsel or any other member on the committee, I'm gonna ask that we strike at the appropriate time with the.
Time. I mean, well,
You know,
the appropriate time.
I wanna ask the author to and get a read on her. Instead of the word addiction, I would like any place in the bill that says addiction to say substance.
Okay.
Is that agreeable?
Yeah.
At the appropriate
Okay.
time?
Anywhere, okay, at the
Well,
appropriate time.
now that does sort of change the connotation,
it
though,
may-
where you're talking. I'm not
that-
looking at.
That
Like-
goes back to my previous question. For the members of the committee that don't want to deal with the issue that you brought before, this word certainly does not leave, substance wouldn't leave that door open.
Okay, but we're not chasing substances. We're chasing what's driving the addiction. So I don't know that.
Creating the House Study Committee on Mental Health and Substance Treatment?
What about substance abuse?
Substance abuse treatment?
Yeah, that would be fine. Substance abuse.
Treatment.
All right. if members of the committee can help me find where that word addiction is, can circle
Well, we
that.
can let Betsy do
Yeah,
that.
okay.
Betsy is here. She's looking for it. So let me
Okay.
get a motion on the bill. Okay. Okay. Do I have a motion? I don't have a motion. All right. You want a motion to lay it on the table at this time? I can't move forward without a motion.
Okay, well, I
Representative?
find that unfortunate that we don't want to look at this in our state, but I appreciate you taking it up and allowing me to
Madam
to
Chair.
have it heard.
Right, yeah?
Madam Chair, there's been some discussion, and I'm gonna really ask you for a very unique posture at this time, if I can, and just ask for a 30-second recess. 30 seconds is all I need to confer with you privately and Chairman Hatchett. Is that in order?
Sure. Okay. All right, we're back in. Okay. All right, what is,
Thank you. Thank you, Madam Chair. The conversation is, we do have a vehicle out there at Senate Bill 4. We're concerned if somehow Senate Bill 4 didn't see the light of day, we need another mechanism, and this very well could be it. So with that, Madam Chair, I move that it do pass.
all right, I have a motion, do pass. Do I have a second? I've got a second. Okay, I got a motion, do pass, and a second. Let's take the amendment up. You'll state your amendment, Representative.
Yes, with the help of Legislative Council, I think I see it on line 1, and I think I see it on line 2, the word addiction. I'm sorry, 20, thank you. 1 and 20. I move, Madam Chair, that we strike addiction on line 1 and 20 and change that with substance abuse.
Okay, we have a motion. I think everybody can understand it, that where it says addiction, it'll be struck, and that we will put substance abuse. Do I have any opposition to that motion? There's no opposition. The motion is carried. All right, is there any further discussion? We have a motion do pass and a second and an amendment that's been passed. Do we have any other discussion on the bill? Okay, no discussion. Everyone in the favor of the passage of House Resolution 627 as amended, say aye. Anyone opposed? No. All right, the ayes have it. Thank you. All right, okay. Representative Turner, you're here this time. We had you first. We got to you earlier, but, okay, you have a very short time. We have members that want to go to Senate rules, including myself.
Including me.
Okay.
Okay, so this resolution is a study committee that would study federal healthcare changes and the impact it would have on state healthcare policy, designed for us to have a resource ready for us to go to make policy recommendations based on those changes that will inevitably happen this year, so we can tackle them very early next year when we get back into session. And that's what it is.
Okay. All right, discussion from the committee. Okay, Representative Hatchett.
Representative Turner, do you not believe that part of our department's responsibilities and even our overall responsibility is going to be addressing this when this occurs? Do we really need a study committee because it's going to happen? I guess that's my question.
Yeah, and what kind of resources will the legislature have, and how informed will we be? I believe that this would be a mechanism for us to tackle it head on. If, for example, if you've been following along with the American Health Care Act debate, it's ever revolving and changing. Even today, they're not sure if they're going to be able to vote on that. But having resources available to us to explain what that is, yes, to answer your question, I do believe it is a responsibility, but I don't believe that that is mutually exclusive for the legislature to take action as well and be ready.
Okay. I mean, and just because I said we're in a hurry, I didn't mean for the committee members not to read the resolution if you haven't read it. We're all pretty fast readers. Representative Reinders.
Thank you, Madam Chair, and to my friend who sits on governmental affairs that I always have a spirit of cooperation with. My only concern is the timing. There's a good chance we won't even get a vote tonight because it is, as you put it, ever evolving and changing.
Yes, absolutely.
And my concern is especially because we don't know about the potential cloture rule in the Senate requiring 60 votes, true?
Sure. This is why we're going to study it over the summer.
And that's the exact reason why I think the summer may be a hair too early.
Well, it would be
Do you believe if we do this and we pass this, do you believe it is your crystal ball, and I know how hard that is, especially when you're dealing with the feds,
Sure.
that we're going to have a health care bill that passes the House and the Senate by the summer, and we should vote on this because you believe that?
I believe that there will be changes to federal health care policy that we will have to address.
Agree.
And therefore, whether or not a bill passes, there will be changes to health care policy. So we will have to deal with that as a state. And I do believe that this would be a valid resource for us to use.
And again, Madam Chair, if I may continue, my pragmatism just sits there and says, I really believe next summer is the perfect time as opposed to this summer. That's the only question I'm having, not what we need to be able to do as a state. And you disagree with that?
I tend to, yes, sir.
I like the word
Honorably,
tend.
yes.
Thank you.
Representative Petrie.
Yes, sir. Thank you. I would just like to add that I don't think we can be too early. This is we're going to see, I alluded earlier to the changes that are coming. We're going to have more control here in our individual states, and I think we've got to begin having these conversations. And so if there's ever time for us to study something, this is it. We see a lot of study committees, but at any rate, I'm with you.
Thank you, sir.
Representative Broadway. Where'd he go? Oh, Representative Price.
Thank you, Madam Chairman. Would the concerns about the timing be addressed by changing the line 67 to a future year, or is that inappropriate for a study committee?
I think that would be inappropriate for a study committee at this time.
What was the line again, ma'am?
I mean, if we keep it a lot,
Oh, yeah.
it would have to be this year, because to be voted out, there's 30 minutes for it.
Okay, thank you.
Okay.
I just had a quick question. I know I'm seeing this in other committees too. You know, the end is near, and so a lot of study committees are popping out. And I know last year we had a concerted effort that there had been too many. Is there a limit, or are we aware in rules? Because, you know, we don't want another bill that might be super important, not that yours is not, to be delayed in being heard in rules just because we've got so many study committees. We had all been told, you know, we don't need to have many study committees.
That's right.
They're expensive. Are they productive? So
I'm not sure I follow your question. Are you asking me if I think this is an important measure?
I'm not really. I think I was more addressing that actually to the chairman,
Okay.
actually.
Right.
Because
No, I think-
my feeling is that we've been told from the appropriation standpoint that, you know, those dollars have to come from somewhere. So do we need to be cautious about how many study committees here in the last hour, not only in this committee, but in all our other committees, that we're just trying to push out and
Okay.
burden rules at a time when we also have a lot of measures that are at the final hour.
Okay.
And,
All right.
and that's more of a procedural thing. It's not, I'm not saying that this is not a good thing. I'm just saying we are popping out study committees.
Representative Reinders. Thank you. And wait a minute. I should have answered the representative's question. Yes, you are correct on all those issues. That there are a lot. Yes, we've been told not to pass a great number of them out, that they will be limited. And there is the time issue with this one. So yes, yes, and yes, Ms. Katie. Okay, Representative Reinders.
Yeah, to my friend Mr. Peachtree, I would say tomorrow's too early because we don't know what they've got. It is a timing issue with me. It is a timing issue only with me. So there is a part of me, Madam Chair, that would like to ask about the abolishment. Since the Speaker makes the appointment, he would be the one ultimately that would be able to know when the appropriate time would be, and and so therefore I'm asking the question on that line 67 to Representative Price's point, if we went to 2018, December 1st, 2018, if that would not give the speaker who's going to make these appointments the broadest period of time to see when the most appropriate time is. And I'm just doing a little creative outside the box thinking.
Representative, I've been told
Okay.
that it has to be this year.
All right, and then finally, you've got 7 members in this report. We typically approve 5.
If it would help the committee feel comfortable, I would limit it to 5.
Thank you.
Okay, Representative Newton.
Thank you, Madam Chair. I do think you make a good point that, in particular with the Medicaid funding and the degree that healthcare spending, both for the state health benefit plan and Medicaid funding, is such a tremendous part of what we do here in the time leading up to a budget. Certainly having the mechanism where the speaker, I did notice that the committee chair will decide when to call the meetings, and hopefully a chair wouldn't call meetings until there was something to really research or a particular direction. But this would be the only tool we'd have to have any kind of preparation for next session, the way I look at it, for something that's such a second largest expenditure of state government. So I appreciate the idea and the mechanism to give the House side a tool that could address these issues. So I
Thank you, sir.
appreciate it.
Representative Newton, you're fairly new to this procedures ago. We do have other mechanisms. The departments will be looking at that and presenting starting in the fall and, going back in. So it won't be dumped on us without a great deal of preparation for it coming, just to allay your fears that it might be. Okay, Representative Peasole.
Thank you, Madam Chair. I would like to agree with Chairman Dempsey's point that we have too many study committees, but I would also add that we have taken up some frankly absurd and obscure study committees in this chamber. I'm not talking about this committee in my tenure in the House, and this is certainly not absurd, nor is it obscure. So, my 2 cents.
Okay, we have about 5 minutes. Representative Henson.
It's me again.
Okay.
I had one more thought after hearing some of the comments that have been made. What about an urging resolution? Would an urging resolution that the House take the lead in preparation for it? That kind of leaves the door open. We're encouraging the speaker not to necessarily create a study committee, but the importance of it. Because the issue matters. I'm trying to tell you that I firmly believe that the issue matters. I just don't know if we'll get another study committee out.
Well, ma'am, if this should pass on to rules,
Okay.
and the rules chairman decide not to pass it, I'm okay with that. But I would ask for the committee's cooperation, because this is an extraordinarily important issue of our day and time. And I would ask for the committee to allow me to have that shot to compete in the arena of ideas around which study committees are important and which are not. And I would ask for you to allow me to have that opportunity.
Okay.
Creating a study committee does not also mean that you're appointed to the study.
And I would be
committee.
fine with that.
So
What I want to
idea of the
see,
issue, right.
what I want to see is us have this resource available to us when we come back next year, because we know the changes are coming. We know they're coming, and how we deal with them and how we are prepared for them is important. And so I believe that when we look at the importance and some of the things that we have studied in this body, study committees that I voted for, do not rise to the level of importance and the impact on the state budget that we have with this particular study committee.
Okay.
All I would ask is the opportunity to have that chance.
Representative, okay, as chairman of this committee, I have the right to decide whether we're going to vote on something or how we're going to handle it. There is so much chatter and notes being sent to me that I'm going to take the chairman's prerogative. I can appoint a subcommittee at any time that I want to appoint a subcommittee on an issue. And what I'm going to do is I'm going to have us not vote on this, and I am going to appoint a subcommittee to look at part of this issue in the fall if we've had anything done. If nothing has passed, I will put it off, and we won't do anything. But if the feds have passed a change to the health care law and there's coming, then that's how I'm going to handle it. And I will make sure that you are very much a part of that. You may have to take your personal days because you're not on the health committee, and I can't pay you for that. But
You
if
don't have
will-
to.
if
I would
you will
I would gladly volunteer
if you
for
will
this effort.
save your personal days, and I will appoint a subcommittee, and if any of the members want to be on that subcommittee, if you will let me know before we adjourn from this session, let me know, and I will appoint a subcommittee to look at this if things move.
Thank you, and that is a tremendous win for me today. Thank you.
Thank you. You're welcome. Okay. Yes, because you have 2 minutes before we go to Senate rules.
All right, you got 2 minutes. But thank you, Madam Chair. But I think one thing we need to do is to have the speaker or someone put together, honestly, a study committee that will give the people an idea what really needs to be handled in a study committee or what can be handled through different departments. And also you had mentioned going in his particular one to 5 people instead of 7. But I think that he should keep it 7 because a lot of times you put 5 people on the committee. Sometimes you have 3 show up, 4 show up. So that at least gives the option to start with 7, but maybe have 5 that actually present sometime.
Okay, Representative, thank you very much. Yeah, that's it. Okay, thank you. We are adjourned.